Welcome to all three of you. I can see that you are wearing your masks and keeping your distance. And let's just talk about the fact that these surgeries are proceeding, and also you are taking every precaution possible to keep your patients safe.
Yeah, out here in the Woodlands, we are proceeding with surgeries, particularly bariatric or weight loss surgery. And we have lots of precautions that we're using to keep patients and even staff members safe in the times that we're facing.
And we should mention, too, that, of course, as we said, Memorial Hermann's in the Woodlands, you are located in Montgomery County and unaffected by the governor's order on elective surgery. So we want to make that point stressed right now. But let's talk about the precautions that you all are taking to keep your patients safe during this time.
So all of our staff wears universal precautions from entry through the process of surgery and then even on the floor after surgery. Our patients are all getting tested for COVID as well. And we do that prior to surgery so we know the status of each patient as they come in.
And let's chat about some of the benefits of having this surgery. As we mentioned, you have one of your patients right there, Diana. And for folks who have maybe considered having this done, just talk us through how it can affect someone's life.
Well, I think bariatric surgery affects a person's life dramatically in all aspects. But we're faced with unique times with COVID. With COVID, we know that a person who contracts COVID and has weight problems or obesity, they're 3 times more likely to end up on a ventilator and have a poor outcome. And so in the face of COVID, we've seen an uptick in the requests for our bariatric and weight loss surgery. And what we do is we take patients through a preoperative process. We work with nutritionists or registered dietitians, and then we work with a psychology team that helps prepare our patients for surgery. And that process takes a little bit of work and doing prior to proceeding. We spend a lot of time counseling our patients directly as well. We see them in the office at least 2 times prior to surgery, just in terms of consultation, talking about the procedures and what they're getting ready to get involved in.
And to be clear, too, bariatric surgery is not one type of surgery. It's not one surgery fits all. There's actually several different types, correct?
Yeah, yes, there's the gastric sleeve, which is by far the most popular, which is just reducing the size of the stomach. There's a lap band, which just kind of restricts some. And then there's the gastric bypass, which actually is a full rerouting of the entire intestines. So all those surgeries are available and all are being able to be done still here in the Woodlands. And we're able to perform all of them very safely. And patients are only in the hospital for about a little over 24 hours. So their exposure and their risks are very, very minimal to anything COVID in the hospital.
So many different options when it comes to these types of surgeries. Diana, I want to get a little bit of your story. I understand you're a nurse and you just had the procedure done this month?
Yes, I had my procedure, the gastric sleeve, done 12 days ago. I'm a nurse at Memorial Hermann, the Woodlands Medical Center. I'm an educator for surgical services.
12 days ago.
And I feel very safe with the care that I received here.
And how has it been? I mean, only 12 days, that is not very long ago. How are you feeling? What have you noticed? And can you talk about sort of what your weight was and what your goal is?
I feel great. I had minimal discomfort in my incisions. Once I went home, I only took Tylenol at home, and it was completely effective against any discomfort. I've lost about 12 pounds since my procedure, and I'm able to drink just fine, drinking protein fluids and other soft foods.
Well, it's good to know that, I mean, it's unbelievable that you just had this surgery done just so recent and during this pandemic. And I know, doctors, both of you can really attest to this. And of course, Diana, you can too. Once you're prepared for this type of surgery, you know, there's lots of prep work going into this, but to be able to go through with it during this time, I think is so critical, not only for the patient's health, but also the peace of mind that they are going to be able to achieve this goal regardless of what's going on around us.
Yeah, for sure, they're going to achieve the goal. And I think I would take it a step further in a sense that As you can see, 12 days post-surgery, we have our patient right here with us.
Yeah.
It shows you the recovery process and how quickly it happens, particularly, again, as I mentioned before, when COVID has such an increase in severity when you have weight problems and weight issues, that coming in, having a procedure like this, getting you in, getting you out of the hospital in a safe fashion, and then you can see 12 days after surgery, you are mobile, up and at 'em, and starting to resume a normal life. It allows us to put our patients in a nice, safe perspective in terms of healing as well as exposure when they're here.
And we are just about out of time, but I think what you said at the top of this interview was very critical, that for someone to carry around so much extra weight, you know, the long-term health risks of that far outweigh any short-term risks of having the surgery, correct?
Yes, and on top of that, the surgery gets rid of diabetes, high blood pressure, sleep apnea, all these other risk factors that come into play that also put people at more risk of a next wave of COVID. So the weight, the other things all start to go away. And so we see patients that we operated on just right before that first wave of COVID hit in March are now at, a significantly less risk of having any issues of being in a hospital if they catch this COVID disease.
All right, Dr. Jason Balette, Dr. Drew Howard, Diana Barnett, thank you all for your time. And Diana, continued success in your recovery.
Thank you.
Thank you.
Thank you.
And in the meantime, if you are considering weight loss surgery at Memorial Hermann, the Woodlands Medical Center, you can call 713-897-2300, or you can visit the website weightloss.memorialhermann.org.
And we'll be right back with more Houston Life.